Good evening, good afternoon, and good morning, whatever part of the globe you are in. Welcome to Weekender on Sunday. My name is Sunil Kaushal, and I'm your host, and it's great to have you join us this morning, this afternoon, and this evening. What a week it has been, both in politics, sports, as well as the new discovery of COVID strain. Starting with sports, New Zealand's playing India in Kanpur. And on day 4 today, it seems like anyone's game at the moment. We'll just have to wait and watch. The first ball has been bowled, and India is in their second innings. Moving on to something new, sounds like a name from the Transformers series, the new deadly variant of coronavirus, Omicron. It's come out of South Africa, and quickly and rapidly the world has decided to close its border to many countries out of South Africa. It still has to be seen what sort of a strain it is, but according to some scientists, it's about 30 times deadlier than the existing Delta variant. One good thing is that we are finding out the Greek alphabets, Delta, Omicron, etc., etc. So good to brief up our Greek. Moving on to politics in New Zealand. It's been one hell of a week for National Party, probably something that they don't want to remember, but it is what it is. The suicidal strategy from Judith Collin, leaving her out of the field. And on Tuesday, we will find out who the new leader of National Party will be. Unfortunately, as one can expect, Simon Bridges had to pull out. However, today we are joined by two members of Parliament from the Labour Party, Honourable Michael Wood, who's the Minister of Transport, Minister of Workplace Relations, and also the Deputy Leader of the House, as well as the rising star in New Zealand politics, David Seymour, the leader of ACT Party. Welcome to both of you, gentlemen.
Good afternoon, Sunil.
Thank you for joining us. Before we start, I think we should all congratulate Honourable Julianne Genter, who had a baby girl. She did well. True to her word, she drove to the hospital to give birth to the baby girl. We wish her all the best. Michael, starting off from you, you just announced a few of the policies this week. Isn't that some businesses think it's too late?
The policies that we've announced this week have been about how we transition to the COVID protection framework. And the main thing about the COVID protection framework is that for many or most businesses, it allows us to get back to things being open, and it allows people to get back to the things that we love, especially for people who are vaccinated. And so the things that we've announced this week give a bit of greater clarity and certainty around how businesses can operate, particularly around that question of what are the requirements around workforce having to be vaccinated if businesses open under the new framework. That's something we've been working through very carefully with businesses, with unions, with industry organisations, because the issues are important and they cover a range of quite complex human rights issues. So we've taken a little bit of time to get them right, and I think we've got the balance right. And the feedback that we've been getting from the business community has been that that gives a lot more certainty in terms of how we open up and move forward.
That's fine. So you mentioned about, especially in the government department, like the police, etc., right? Some of the police may leave. Now, David, I will come back to you just recently, this week, what happened in Mount Eden. That couple has been, robbed so many times. Yet the police are not coming up on time. And while Michael says it's important for our police to be, and it's fair enough, because you don't want to put the police in danger, but then we are about to lose some police force. Is that enough? Is that a good thing?
Well, look, there's a couple of issues there. First of all, there's a number of people who do business in central Auckland who are being really terrorised. One of which just down on Mount Eden Road, the dairy there, the two older men were there late at night. They got bashed. The police came in that instance. In other instances, a single police officer has shown up and ask the owners to basically be their backup and go into the dairy with them because they don't have any other backup. So there's a few things that feed into that. One is we don't want to criticise the police. I mean, as a local MP, I work with the local cops, and they're some of the greatest New Zealanders. They do long hours, they go into dangerous situations, but they're just being asked to do too much. I mean, I drove from Tauranga to Auckland 2 days ago. I saw more cops at the border than I've seen in Auckland all year. They're being asked to do that. They're being asked to do MIQ. And one of the consequences of that is that they're unable to be in central Auckland protecting us from serious crime. And people who work long hours to keep convenience stores open are some of the biggest victims of that right now. What's the solution? Well, I think in general, the government needs to start being a little bit more realistic about COVID. Michael's saying that we've made it clear and, we're going to get our freedoms back. I mean, that's all true. But that's something that should have happened months ago. Anybody can quarantine a remote island. Anybody can pass a law that says, at some point we're going to have a system of being vaccinated and allowed to go into a store or not. But it's all happening months after it should have, because the government simply was not prepared for Delta. They made no preparations for Delta. They've been scrambling for the last 3 months. And now people are paying that cost in all sorts of ways: a shortage of police, inflation, rising costs of living, fatigue from being stuck inside.
That's fine. We'll cover those topics.
It's endless costs because the government has been so slow in responding to Delta.
Yeah, but my question to you is, I'm asking for a solution. What alternate solution would you provide, when the workplace minister is asking all the workplaces to be vaccinated, which will obviously mean people, and look, we have to protect our workforce. There is no doubt about it. But what's the alternate solution?
Well, look, on the issue of losing essential workers to vaccine mandates, we've said for quite some time now the mandate should require vaccination or testing, because if the objective is to ensure a person that you interact with is not likely to pass on COVID, the preference is they get vaccinated. But right now, 14% of police officers are not vaccinated, or say they won't be. We can't afford to lose more police officers.
Okay, I'll come to you, Michael. Michael, do you think we should have the testing in place for those who are unvaccinated at workplace?
For some of these absolutely essential workforces like police, defence, our MIQ workforces and those workers at the border, we do know that vaccination is the very strongest protection that we could put in place. And that's why we've put that requirement in. And I absolutely back that. Vaccination means that people are less likely to get the virus, they're less likely to transmit it, and they're less likely to become seriously ill. We have, under the COVID legislation we've passed recently, provided the ability to also put testing requirements in place. So that does start to maybe address some of the points that David is making. But for these critical workforces who are interacting often at very close quarters with people, think about some of the work that police do. We do think that for their benefit and also for the public interest and the confidence of the public, that we want to know that those officers are vaccinated. And I do just need to clarify the stats there. The key thing to know here is that 93% of police officers already have had at least their first vaccination. They haven't necessarily had both, but they've at least had their first vaccination. And our experience with these workforce mandates is that when we put them in place and provide a very clear date, that in the final few weeks before that date, some of those people who have been on the fence and putting it off, well, quite a few of them actually, get on board and get vaccinated. So I expect that the numbers that we might lose at the end of that will be relatively small, but I think it is essential in terms of public health and safety. And I'll just make this point as well, when we're talking about police and numbers, that it's our government that's got police numbers up to record levels. Under the previous government, we had a number of years there where police numbers didn't just flatline, they actually fell. We've put the investment in to get them up, and we'll continue to do that.
Sure.
Yeah, but there still aren't enough there, Michael. And ultimately, what you guys need to get better at is balancing different risks. So yes, it would be good if everyone was vaccinated, but even if it ends up being 5% of police officers who aren't vaccinated, that's nearly 1,000 cops missing out. Now, wouldn't it be better to say, look, if you really don't want to get vaccinated, get a test every 3 days. That's good enough, because I'd rather have a cop who's tested every 3 days on the beat than no cop at all. And that's the problem with this government's response, is you guys simply don't balance the costs and benefits and manage different risks you face.
Michael,
Well,
he's got a, sorry, I'll let you answer that. But what I want to add is the reason, because we are getting a lot of calls and messages from people, given that there is a rise in crime, and for us to lose police, and I hope it's not, but, to lose, as David is saying, 1,000, it may not be 1,000, but to lose them and then to train another, let's say even 300, 30% of them, it'll take another 3-4 years. So isn't it better to put them somewhere else within the police force where they are not, where they're not in contact with vulnerable people? Michael, I'll let you answer David's question first.
I'll answer that specific point and then happy to address the broader point that David raises.
Yeah.
On that specific point, under the workplace vaccination mandates, there is an obligation on the employer first to look at redeployment options that might be in place. And we encourage that if there are places where these officers can be shifted to within the broader police workforce that are not covered by the mandate, that are lower risk, then we do want that to happen in the first instance. But I'll come back to this bottom line, that in these roles, for people working in our health system, our education system, at the front line with police and on our borders, you just cannot go past the core protection that vaccination provides. And consistently, New Zealanders tell us that they back the mandates for that reason. On the broader point that David raises, at a high level, I do agree. This situation is about balancing risks. There's no one or simple or magic answer to help us navigate our way through the COVID-19 global pandemic. It is about assessing a range of factors and trying to strike the right balance. So, that's what we've done, for example, with the workplace vaccination mandates. We've had a whole range of sectors and employers saying to us, we want them now, it'll make our lives easier. We want the government to dictate that all workers in our sectors should be vaccinated. We've taken a bit more of a careful approach to that, and we've applied them in places where we think it is really essential in terms of public health and safety. The other point I'll just make is there's a counter argument here as well, which is that if we do have workforces like police, for example, where you have a reasonable number of people who remain unvaccinated, the risk to the service that police provide there is that actually it's more likely that those people in the future get ill with COVID-19, and you then have significant problems in terms of police being able to deliver the services that we all rely on. So again, there are no easy answers here. It's the same with the broader balancing up of where we put police resources. David's right to an extent. Police have got a number of important tasks in the COVID-19 response. But we do think it's important that while we're managing an outbreak in Auckland, that we do have borders. They'll only be in place for a couple more weeks in the way that they are now, that prevent that infection from moving out to other regions and causing a huge public health impact there. So we have to manage these things and we have to balance them. That's an ongoing piece of work. But as I say, I think that we've got the balance pretty right at the moment, and we'll continue to work to make sure that we do.
Sure. David, I'll come to you now. You probably read the the Simpson-Roche report. Do you think the government has failed New Zealanders?
Well, I do. I mean, we started with enormous natural advantages. No other country can claim to be as isolated, have its population so spread out, to have such a young population, to have a population that is prepared to follow the rules very carefully, and is a comparatively wealthy country by global standards. Nobody had New Zealanders' suite of advantages going into COVID. And at one point, I actually asked Chris Hipkins in Parliament, can you think of a question with a country with more natural advantages than New Zealand? And of course he couldn't, but I just wanted to check. Given that opportunity, the government, I'm sorry, but it's just rested on its laurels for far too long. I mean, you take this vaccine rollout and the vaccine certificates. Vaccination started in February. Now that was already very late by world standards. But then the task of actually recording who was vaccinated and giving people proof that they'd been vaccinated, that took a further 9 months. They seem to be asleep at the wheel and only started to answer some of these fundamental questions after Delta hit. So, unfortunately, when it comes to any number of things, I mean, we could talk about testing, the saliva testing rollout.
Yeah, we'll go there.
Now the subject of a major investigation. Yeah. We could go on and on, but everything is late, everything is too complacent, everything's last minute.
I just want to ask Michael, David mentioned the government has been asleep on the wheel, okay? And the Simpson-Roche report, certainly points out so many things. For example, lack of clarity in testing framework. Border control directive have been difficult to understand and implement. Lack of good forward planning from the perspective of end-to-end system. And it keeps on going. I mean, you obviously have read. Both of you and everyone's read that report. But there seems to be that government is very good at communicating certain things, but in a sense, it's just smokes and mirrors.
Sunil, I think that this broader narrative that David's just presented, and we hear from the opposition at times, that somehow New Zealand's just sort of rode its luck, had all of these natural advantages, and that all of the extraordinary outcomes that we've achieved as a country together, the lowest death rate in the world, one of the lowest rates of hospitalizations, one of the most robust economies throughout an enormously difficult period, that somehow those things are just luck. Well, I've got to tell you that when a global pandemic rages, it's not about luck. It's about people pulling together. It's about very clear leadership, and it's about focusing on what is actually good for the well-being of the people. Our response on all of the core metrics that matter has been amongst the strongest in the world, and I think that's why Kiwis continue in large numbers to back the response and to support it. Now, none of that is saying that everything's been perfect. And one of the reasons that we've set up this ongoing process of having Sir Brian Roche reviewing and reporting on the COVID-19 response is that we want to continue learning and continue improving. That's the way that you make things better. So, yep, when those things get identified as part of the response, we'll move on and we'll make constant improvements. I think one of the things we've just got to remember is that no country, New Zealand included, had a playbook for how you deal with a pandemic like this. And it is true that large parts of the response have had to be developed iteratively as we go along. It is true that there are trade-offs and choices to be made within that. It is true that large parts of our public services, including our health system, have been very stretched at times and sometimes haven't been able to deliver it at absolutely the level that we would want them to. Those things are part of the reality of dealing with a 1 in 100 year global pandemic. I continue to think that New Zealand's done well. And I'll come back every day of the week to the fact that we've seen fewer of our citizens die and get seriously sick as a result of this pandemic than others, and put that against any other country's response.
Michael, I agree to most of it. I think, out of all many countries in the world, at least the government has helped, with the research and payments and different things, with businesses. Okay, that may not be enough, but something's better than nothing. You look at the positives of it. But what I'm coming back to my original question, which I asked you was the government sleeping at the wheels with knowing and preparing late? And with the report that has come out, it's all good in hindsight to say yes. But, if you were a corporate and if you did something like that, you would be sacked. Okay, here is a democracy. We understand that. But Michael, what I'm not hearing from you is that why was there a delay? And why, when the Prime Minister always says, as per the advice of the Minister, Director General of Health and all those things, right? And we know from the papers released that the Director General had requested certain things, for example, South Holland level, etc. But none of them were heeded. So why has this still happened? Upon when we are good at communicating, etc. That's what I want to know. Why was there a delay?
Well, look, there's one interesting point in there I'll pick up to begin with, and that is the comment. Well, why weren't the Director General's comments heeded? Well, I can tell you that at every single cabinet meeting when we consider serious COVID-19 policy matters, we listen very carefully to the advice of the Director General. At times in this response, there's been criticism of the Director General and us because some people think that he's had too much say. In the end, the important thing here is that we do have a democratic system. The government has to consider a range of factors when decisions are made. We take the public health advice, but then actually in our response, we do consider a range of other factors as well. And that's been the case up until this point. It'll be the case under the new traffic light system as well.
Give me a couple of factors that you would consider.
Sure. So under the traffic light system, for example, we've said that as we consider changes to levels, yes, we need to consider the core public health advice around the strain on our hospital system, around the rates of vaccination in different regions. But we've also said that we need to consider the broader social and economic issues that are at play. We do know that there is an effect and an impact if we have measures that are stronger than might be ideal in terms of businesses, in terms of employment, and also in terms of the broader degree of consent and support that the public has. And that's an important point as well, because
Sure.
ultimately
David,
we don't live in a police state, and if we want people to follow measures, we need to bring people along with us.
That's
So we
good to
consider
hear.
that range of factors as we make our decisions.
David, are you agreeing or disagreeing? Because what I'm seeing is that, looks like the Director General has been thrown under the bus.
No, look, I think here's a bit of a thought. I mean, we could go round and round about whether the government's been, timely in its response and balanced the right things. I clearly think they've been late and they've failed to balance the different needs that New Zealand has, and people are suffering in all sorts of ways as a result. But let's park that for a minute. I mean, I'll just give you this observation. The Director General of Health has been to Cabinet 20 times this year out of about 50 Cabinet meetings. That's more than James Shaw, for example, who's a minister but outside Cabinet and doesn't get to go very often. Now, I don't necessarily have a problem with Cabinet listening to the Director General of Health in a pandemic. In fact, that's probably a good thing. But here's the question. Why aren't they getting the Secretary of the Treasury in to talk about the economy? Why aren't they getting the Secretary of Education in to talk about the fact that Auckland kids have lost over 100 days learning in the last 2 years and everything that means? And I would say that the public health profession, which you've got to remember has spent the last 20 years lecturing people not to have too much sugar or alcohol or not to smoke tobacco, that is very controlling and deeply distrustful of private business, has had far too much influence on the government's response. And what they could have done is listen to a wider range of voices. And this is something that, we've put out 3 policy papers on how the government could deal with COVID. So this is not just idle criticism. One of the things they could have done is appointed an epidemic response unit that was multi-departmental and public and private sector, so that they could get some balance. Because if you look at the decision making, here's just one. We're going to open up the border to foreigners on the start of April, all going to plan. That means that if you're the University of Auckland or Otago or Canterbury, then you've just lost another semester for no good reason, while Australian and Canadian universities are out there eating our lunch. Now, there's just a lack of joined up thinking and a lack of real risk-based risk comparison and analysis. And maybe one of the reasons that we're not allowed to take risks is that our ICU capacity, which is critical to backstopping any risks that New Zealand takes, is actually lower than it was 18 months ago. I mean, some of these things are just extraordinary. And so, of course, it's always easy to say, well, New Zealand's done well. Well, New Zealand has done well, mainly because of its natural advantages and its people. But what we need to assess is how has the government performed? And my claim is that A, the government has performed very poorly, and B, if they'd taken some of the suggestions ACT made over the last couple of years almost, then they could have done a lot better.
Sure. To both of you, I've just received a text, probably from a healthcare worker, says that we have worked round the clock since 2019, yet lowest paid. What's their solution? I'll go to you, Michael, first.
Sure. Look, the healthcare workforce has done an astonishing job over the past couple of years. And it's a reminder about why we do need to keep investing in our public services. And that's, that's one of the things that I'll just point out as a part of this discussion. It's our government which has begun to rebuild those public services after the previous government did run them down for years and years. We've invested significantly in pay settlements for people like our nurses and others in the broader health service, and there's much more work that needs to be done there. I think that many of those people have been heroes of our COVID-19 response, and when you look at actually the way in which we've invested in them, it's a marked contrast to what was occurring before. But as I say, we'll continue to look at that, and there's much more that needs to be done. There's also a critical point here actually about the capacity of the workforce, and we do need to build that up. You take an average nurse, for example, we do need more nurses. We don't have enough ideally at the moment. Well, nurses take 4 years to train, and that's a problem that we face. There was no national plan for training up the nursing workforce when we came into government, for example, because the previous government didn't believe in that. So we're starting that investment. There's much more to do. And I'd just finish again by thanking the correspondent who's written in for their extraordinary work, and we'll continue to back them.
David, I'll come back to you, but you're talking about, Michael, you're talking about nurses, training them, etc. We are in a global pandemic, right? And we know there are nurses across the world who want to come to New Zealand, but our immigration system is like that. Don't you think it would have been a great idea or great initiative from the government to allow that to happen, just for nurses to come, or builders to come, etc.?
Well, look, this is one of those areas where, of course, there is some tension, and this comes back to David's previous comments and that ongoing discussion. At every point of this pandemic, when we have taken steps to limit the possibility of COVID coming into New Zealand or limit the possibility of it spreading in New Zealand, through our strong border management or through our alert level system, at every single point, we've had voices coming in at us saying, no, don't do that, you've got to open up. And had we done that, I have absolutely no doubt that we would have had more cases coming into New Zealand. We would have had more illnesses and death. These are not easy decisions, but I think overall we've got the balance right there. We have, of course, gone to some lengths to try and build up that workforce. We've had the decisions over the last few months made by Minister Chris Farfoy to create a pathway to residence for many of these people. I think that was a really, really good move. It's the biggest such move that any government's made for a very long time in New Zealand.
Sure.
And of course, as we move into 2022, there's going to be a bit more capacity with our borders to continue supporting that workforce.
David, do you think what Michael is saying is true to a certain degree?
Well, I mean, in the terms of there's a trade-off between how much risk you're prepared to take against COVID and how much you want to get our way of life back and fulfill other needs. Yeah, he's right. They have a trade-off. We all know that. I guess what I would say is that when it comes to nurses and also teachers as well, and you talk to principals who've got major problems with staffing, the real challenge is that the border has become a one-way valve. People have been leaving, but it's very hard for them to come back. Michael talks about the pathway to residency. That's great, but you have to already be here. It doesn't count people who are currently offshore or people who have been studying as students. It only counts people who are currently here on work visas. The question is, how do we get more people in faster? Now, we're quite prepared to home isolate thousands of people that we know have COVID because the government tested them and found they have COVID. And yet we're not prepared to let people go through a home isolation program to come to New Zealand, even if they're intensive care nurses, for example, or teachers needed for next term, starting up at the end of January. So we've got to start balancing risk better and say, look, there's no logical reason why we couldn't have up and running by now, and ACT has been saying this, since before people said it was vastly irresponsible to even think about these things. We need to have a much more dynamic way to safely get people through the border than making them stay in a hotel for 2 weeks or even 1 week. The thing is, we're all getting to the same place. COVID will become endemic one way or another. The question is how much we spend trying to delay the inevitable and how prepared we are to protect people when it does. And on those two measures, we're just not doing as well as we could be if we were more nimble, if we were more prepared to partner with business, if we were more prepared to use better technologies, all of the things that ACT's been saying for over a year now. The government has dragged its feet, and as a result,
okay, Mike,
we're now seeing rising costs of living because we've borrowed and printed so much money to tide ourselves over.
David, if you were in government, would you open the borders tomorrow?
What we'd do with the borders is we'd say, first of all, we're going to partner with private sector organisations that have gone to government and said, here's how you do home isolation. We would allow people to isolate the 3-day negative test before they come, negative test when they get on the plane, negative test when they get here, 3 days isolation, 4 tests in 7 days over that period. And we would have the right technology to track them and monitor them. You can get a wristband that tracks people now for $30, but they're just not doing it. I know the government has had private sector proposals to do that. So would we open it? Well, it's a question of what defences you would have. And we would have defences that would massively reduce the chance of a COVID case getting through, but also allow people to actually come to New Zealand, do business, spend money, be intensive care nurses, reunite with their family, all of those things that people desperately need.
Michael, David's got some points there, right? And what people don't understand is, why are we waiting so long when we can do the same thing tomorrow? For example, from Australia in February and April, why can't we open now? The tourism sector is crying out. In April, coming to winter, only some of the Aussies would come. So why are we delaying this when we can do all these things now? Are we not prepared or geared for it?
There's a really interesting thing that one can observe around the world in terms of this connection, this question about how do you as a country reconnect? Because obviously, I mean, David's right there that ultimately everyone wants us to be able to reconnect to the world more broadly. The question is, how do you do it safely? What we've seen time and time again is that when countries around the world have dived in, have gone too quickly, have caved into the pressure and the loud voices, that very often they've ended up with significant COVID infections and they've then had to backtrack. And that's what we don't want to have. So, countries like Denmark, countries like Austria and others, where they've gone a bit too fast, a bit too hard, and they've ended up having to put more severe measures in place later on. Our approach to reconnection is to be careful and staged. So we said right from the beginning of this year that it was a 3-step process. Number one, become one of the most highly vaccinated countries in the world. And we're getting very close to that, close to those 90% marks. Number two, bring the COVID protection framework in place. And the reason that's important, and this is where David is right, this is about how we move into a place where we do understand that COVID will be there within our communities. But the COVID protection framework enables us to manage that without having to lean on lockdown so much. You get that in place first, and then you're able to begin the staged reconnection where you do have a higher level of risk of additional cases coming in, but you've got the framework there. So that really is the answer to your question, Sunil, that we need to bring the framework in place. That's what gives us a higher level of protection. Then we can begin the careful and staged reopening. That does begin from January, so it's not too far away, and I think everyone's looking forward to it. But I'd rather we did it in that careful and staged way rather than rushing in and regretting it later on.
David, what Michael says about being cautious approach, to a layman, that would be right. You don't want to end up like countries in Europe that are going through at the moment. And we know the new strain that's coming through, it could be deadly. So I think none of the team of 5 or 6 million want that in New Zealand. I think it's inevitable that someday it will be here. But do you agree with this cautious approach that Michael is talking?
Well, no, because you can always justify failure and delay and frankly just being disorganized by saying, well, isn't it good that we waited? It's a little bit like, you order pizza, they show up 2 hours late and they say, well, isn't it fantastic you've got pizza now? Well, yes, everyone loves pizza. But the fact is it was 2 hours late. And that's pretty much what this response has been like. The question you raise around Omicron is a much more important one, I think, because Omicron is a variant and there'll be a lot more. We're only halfway through the Greek alphabet at this point. There's a long way to go. And this virus will keep mutating. I mean, the flu, as we currently know it, is a 100-year-old descendant of the Spanish flu that hit in 1918. So there's going to be more variants. The question is, how do we respond? I think that the reality is that it's already in far more places than we think. It will almost certainly get to New Zealand. We're not going to be able to stop that happening unless we're prepared to keep New Zealand locked down forever. So let's accept the reality that Omicron and further variants are going to emerge. They're going to travel around the world and they're going to come to New Zealand. The question is, are we prepared and how do we respond to it? Do we have the testing, the tracing, the treatments, the ICU beds, and all of the things that every country is going to need? That's where my challenge to the government is. I think in the very first instance, in the next 2 weeks, one thing the government has done absolutely right is putting those Southern African countries on a no-fly list or on a high-risk list, because it's going to take a couple of weeks before we understand, is it more virulent? Does it make you sicker and kill more people? At this point in South Africa, hospitalization and death actually hasn't risen, so that's really good news. Is it more infectious? It appears that it may be more infectious, but we don't know that because there's so few cases at this point. And can it resist vaccines, in particular the Pfizer vaccine that we've relied upon in New Zealand? We need at least a couple of weeks to find the answers to those questions. And having a no-fly list to those countries where it's most concentrated is the right thing to do. But ultimately, the answer is the same. It's going to be here. And the question is, how good is our testing, tracing, and treatments to deal with it?
Michael, the other day, Minister Chris Hipkins did not rule out, going back to the levels 1, 2, 3, 4. Do you think if the situation gets worse come next year, and with this new Omicron here, would we be looking at going back to 1, 2, 3, 4?
I think one of the lessons for political leaders the world over, as we've dealt with COVID over the last 2 years, is that you're very foolish if you stand up and you rule out what may or may not need to happen in 6 months' time. Because as we've seen with Omicron that we've just been talking about, this is a constantly evolving situation, and there isn't necessarily a playbook there. So it would be foolish to rule out options. The broader play with the COVID protection framework is that we want it to be a tool that means that we have to use lockdowns much less frequently than we have had to in the past. Up until this point, under the alert level framework, they've been the main tool that we've been able to lean on if we have an outbreak. Under the COVID protection framework, the main tool we lean on is vaccination. And that's why effectively under the framework, if you're vaccinated, life's going to be easier for you. If you're not vaccinated, you are going to have fewer choices. And that's not a glitch. That's a part of the design system. And it's a part of how we manage things and have to use lockdowns less frequently. But as we see changes, if the virus mutates, if we have to deal with particular outbreak situations, we will continue to put the health and well-being of New Zealanders first, and we would not rule that out in the future if it was what was required to keep people safe. That's been our touchstone over the last 2 years, and it's served us well.
Sure. Okay, last question to both of you before we close this program. Tomorrow is probably the D-Day. The cabinet meets and they announce, etc., new guidelines how it's going to operate. The Act and the National have been calling first day as 1st November or December as the Freedom Day. Michael, what can we expect tomorrow? Will there be some sort of a relief for people all around New Zealand? Would South Island be looking at freeing up, having more freedom than what they have? And would there be more certainty for Auckland businesses? Because as you know, and I know, that living in Auckland is that usually Auckland empties up during Christmas. So they've already been hurting. Will they be hurt more? Because people will want to, most Aucklanders would want to go out. Michael.
We've said that we expect to be moving into the COVID protection framework from approximately the 3rd of December, but we just have to make those final decisions at Cabinet. We always do that on the most up-to-date public health advice, so I won't get ahead of Cabinet's final decision making. We'll have to have a full discussion about that. But that's what we've indicated as being the place that we want to get to by the 3rd of December. And as I say, the key point about the COVID protection framework is that it means that even at red, most of the things that you want to do can still happen. You can go to a restaurant, you can go to a cafe, those businesses can open up, you can go to a gym, provided that the use of COVID vaccine certificates are in place. So we have the mechanisms in there to make sure that life can feel a bit more like normal and we can start to really get into that recovery period for Auckland, because we do know it has been enormously tough under the lockdown conditions. I mean, you make a reasonable point there, Sunil, and these are the trade-offs that are always there, that if people over that summer break do want to travel outside of Auckland, then there might be an effect on businesses in Auckland. But we absolutely think it's the right thing to do from the middle of December to enable Aucklanders to travel. It's been a hell of a tough year. People, by and large, have done the right thing. And we think that if we manage the risk down by requiring people to be tested or vaccinated, there's no way that we would want to stop people from travelling over summer. But I actually think, based on the experience of coming out of lockdown last time, and based on the economic measures and supports that we've put in place, that we're actually pretty well positioned to move into a recovery period. Remember that our growth rate and our unemployment rate have continued to be very, very good, even though it's been a difficult year. And I think that the resilience of Kiwi businesses and government policies are going to help us to rebuild as we move into 2022.
Sure. David, 1st of December, Freedom Day. Do you think the government budged to the opposition, to your call, to National's call, and now they are giving 29th November, they're going to make a call? Do you think that's a step in the right direction?
Well, yeah. I mean, look, a lot of people say, what can you achieve as an opposition party? But for doing it on the 3rd instead of the 1st, we are having a Freedom Day. The whole country moving at once to much lower levels of restrictions. and a new framework, I think is a very positive thing, and I'm glad the government's doing it. And it shows that even a small party can have influence. You know, we give ideas to the National Party, they campaign with us, and sometimes the government takes it up as well. And it's going to be a massive relief to people up and down New Zealand who just don't have any more gas in the tank. You know, we can't have the government keeping on borrowing. We can't keep printing money. The interest rates are going up. Businesses can't stay shut. All of these things, have to change so people can get their way of life back. And that is going to mean that we're almost forced to take bigger risks around COVID, even when there are new variants. And that's going to be pretty scary. We're going to have to hope for a good summer in that sense, because the capacity, people's tolerance, the amount of money the government can borrow, there just isn't much capacity left now to keep doing what we've done. And I just hope that we have a good summer, that this new variant is not going to evade vaccination, and that New Zealanders who have put in an incredible effort can finally have some time off and something to look forward to.
Thank you. Thank you, Honourable Michael Wood, for your time, and David Seymour, leader of the ACT Party. If I don't see you before Christmas, have a lovely Christmas. To both of you and to your both parties, thank you so much for doing what you do for the team of 5-6 million. We really appreciate it. It's been a difficult year, but 6 million, okay, 6 million. And, we do, appreciate the hard work. It's not easy to be a politician, but thank you so much. And we wish you a very Merry Christmas. Thank you for your time.
Thanks, Sunil. Thanks, Mike. See you later.
Thanks, Sunil. Thanks, David. Have a lovely evening.
You too. Ladies and gentlemen, that was Honourable Michael Wood, Minister of Transport, Minister of WorkSafe, and also the Deputy Leader of House from the Labour Party, and from the ACT, that was the Leader of ACT Party, David Seymour. Thank you very much for joining us tonight or this morning, afternoon, wherever you are. Thank you for your time. Hopefully, we will see more to come in the coming weeks, and freedom for Aucklanders. You have a lovely day, and to the team of 6 million, have a lovely night. Stay safe. See you next week. Good night.